Today I'll talk about the hematopoietic stem cell transplantation. I'm Dr. Jun Peng from the Department of Hematology, Qilu Hospital of Shandong University. Hematopoietic stem cell transplantation means the infusion of hematopoietic stem cells from one cell for another person. It usually follows high-dose chemotherapy or irradiation. I'll first introduce the history of stem cell transplantation, and then the definition and biology of stem cells by source. At last, the practical aspect of the transplantation process. In 1957, the marrow was safely infused intravenously. In 1958, there is reports of successful identical twin transplants. In 1969, cytoxin was added to irradiation. In 1970, bone marrow harvest perfected to obtain stem cells. In 1989, peripheral blood stem cells was harvested. In 1990, the first successful cord blood transplantation was reported. In 1996, the first non-ablative transplantation was performed. This is Dr. Thomas, the Nobel Prize winner, for the first successful hematopoietic stem cell transplantation in the treatment of acute leukemia. What are stem cells? The stem cells was not characteristic of specific tissues. It divides for the lifetime of the organism. The stem cells can replenish themselves. The stem cells could serve as seed cells for the body. Then the stem cells may exist in all organs, serve in injury repair, and replace cells as they die off. The stem cells may circulate from one tissue reserve to another. The hematopoietic stem cell was CD34 positive and CD38 negative. During development, they differentiated into progenitor cells, including lymphoid progenitor cells and myeloid progenitor cells. Then the progenitor cells would differentiate into mature T cells, B cells, neutrophils, macrophages, eosinophils, platelets, and red blood cells, etc. The sources of stem cells could be divided into from the bone marrow, from the peripheral blood, or from the umbilical cord blood. If from the bone marrow, it requires the general anesthesia in the operating room. This is the traditional method of collecting stem cells. The peripheral blood stem cells were obtained by apheresis. It is accomplished as an outpatient procedure. At present, it is the most commonly utilized method. The stem cells could also be collected from umbilical cord blood. In adults, the stem cells could replenish cells lost through age or injury. It is the largest reservoir in the bone marrow. Stem cells could circulate in the blood, relocate to fill empty stem cell slots in other tissues. Stem cells could be harvested from bone marrow or peripheral blood in stem cell transplants since late 1970s. The umbilical cord blood stem cells were obtained from blood retained in the umbilical cord and placenta after delivery. Cord blood stem cell transplantation has been used in stem cell transplants since the late 1980s. It is most often used in children and small adults. The double cord transplant played a potential role in adults. The hematopoietic stem cell transplantation could be indicated for hematologic malignancies such as leukemia, myelodysplastic syndrome, and lymphomas and multiple myelomas. It could also be used to treat non-malignant disorders such as severe aplastic anemia, Hurler syndrome, Wiskott-Aldrich syndrome, Diamond-Blackfan anemia. It also could be used to treat inherited blood disorders such as thalassemia, autoimmune diseases, SLE. It is also used to treat solid tumors such as breast cancer, ovarian tumors, etc. That's all.